In the face of an uncertain future, Mathieu Bolduc strives to keep his days as normal as possible. 1 year ago, he was an active 27-year-old, and then everything changed.
I was bouldering with my buddies from work. I felt suddenly really dizzy, couldn't really get my balance right, couldn't really walk properly, and had a lot of trouble talking.
His symptoms worsened overnight. Bolduc ended up in the hospital.
They tell me it was a brain hemorrhage caused by my grade 4 tumor. Basically, my life completely tumbled overnight.
The devastating diagnosis was glioblastoma, a rare cancer affecting around 150 new patients in Quebec each year. Bolduc underwent brain surgery, radiation, and chemo. His medical team also recommended a new treatment that has shown promising results. Novocure's Optune is a device worn on the head for most of the day, ideally for 2 years. It uses electrical fields to attack cancer cells. Dr. David Roberge is one of the physicians who studied Optune's effectiveness.
Of the hundreds of patients on the trial, the ones that had the treatment lived longer on average than the ones that didn't have the treatment.
He says the survival rate 5 years after diagnosis more than doubled with the device, adding it's the only new treatment for glioblastoma that has shown positive results in roughly 20 years. Problem is, it costs up to $27,000 a month, and so far the province has refused to cover it through RAMQ.
It made me feel hopeful until I realized that I couldn't afford it.
A situation that frustrates cancer doctors like Roberge.
If I don't tell you about it, I'm not doing my job. But if I tell you about it and then you feel like you have to mortgage your house, maybe get it, or you can't get it, and you live with the frustration of knowing there's something out there that you can't get, that puts people in a difficult situation.
Optune was approved by Health Canada in 2022. Quebec's Health Institute evaluated the treatment in 2023, but did not recommend coverage, in part because of the high cost. Dr. Roberge says he doesn't understand why the Health Ministry hasn't tried to negotiate the price with Novocure.
There's nothing that would prevent Quebec from joining another province and saying, we'll sign on to a negotiation with another province.
We reached out to the Health Ministry, but it did not respond by our deadline. Bolduc also wants Quebec to cover Optune, but he isn't waiting. His family members are pooling their savings and more than $50,000 they crowdsourced to pay for it.
People don't have a choice, right? It's either you take it or you're going to die within 2 years.
And while he can only afford a few months, he hopes it will buy him more years with those he loves. Angela Mackenzie, CTV News.